The South African Medical Association has warned that thousands of doctors will leave the country ahead of the planned introduction of the National Health Insurance. The organization says its members cannot support the NHI in its current form. SAMA represents the interests of more than 12,000 medical doctors in South Africa. SAMA says this is because of a deep-rooted lack of confidence in the capacity of government and its financial ability to ensure the success of the service. A survey conducted by SAMA shows that as many as 38% of its members plan to emigrate from South Africa due to the planned introduction of the NHI. About 6% of the members say they plan to emigrate for other reasons, while 17% of doctors say they are unsure about leaving the country. Other issues raised by doctors surveyed include doubts that the national government is capable of running the system. Doctors also say the NHI will not address the failings in infrastructure and management in the public sector. They further raise concerns that the NHI is extremely open to corruption, adding that the Minister of Health has too much power. Now, to discuss this importance of this survey, we are now joined by the Vice-Chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa. Now, Dr. Mzukwa, a very good evening to you. Thanks for joining us. Welcome to the Globe.
Good evening, sir. Thank you for having SAMA on your program, and good evening to your viewers as well.
Now, is the South African Medical Association statement an accurate reflection of the position of the thousands of doctors in South Africa?
Well, it was a survey that really was to test the waters, to understand the feeling of our members as it relates to the implementation of NHI and as it is currently structured. I mean, if you look at the sample itself, really, it's not a very big sample. So it can't be really taken that it's a true reflection, but it is a warning to us that really doctors and healthcare professionals are really concerned about what is envisaged in the NHI as in its current form.
What is the doctors' concerns, though? Because it does appear that their position on emigrating the country, is not an accurate reflection of their position, of their earlier position, that they are committed to the universal coverage or health coverage in South Africa.
Yes, in the last National Council of SAMA, there was a resolution that was taken by councillors to say that we support the universal coverage as it envisaged by the country. But in South Africa, we know that we are using the vehicle of NHI. And it is in that sense that we thought we should support it. In fact, even the NHI itself is being supported. But the main issue was the issue that were raised, the issue of quality, the issue of, many areas that are really not clear at the moment in terms of, concerns about corruption, concerns about specialist services not being clear. The contracting of doctors is not clear. There's many issues that were raised by SAMA, even to the portfolio committee, relating to the matters that we think if government is serious about implementing an NHI, there should be a proper consultation in terms of attending to the concerns that have been raised by doctors. I don't think, honestly, doctors are committed to serving other countries. They are committed to this country. But if they raise issues, those issues must be attended to as related by their colleagues.
Well, some doctors say that the focus should first be on fixing the public sector to a point where it actually appeals to the private sector patients. Is this perhaps not a pipe dream, considering that this has been on the government agenda for decades and billions of rand have been channeled towards the public health sector, and yet the public health system remains diabolical?
Well, I think those are really concerns that have been raised by colleagues, but I don't think it should be taken that doctors are saying that we must first fix the public healthcare system. We know that both sectors have got problems. Both the private sector is also having its own problems. I mean, the issue of quality that is not measured, but also unregulated. There's challenges on both sides. For us to work together, we've got to identify challenges on both sides. When it comes to the public sector, we know the challenges there. We know the cadre deployment challenges, where even people who have no qualifications, simply because they belong to a certain political organization, then they are taken to serious positions without qualifications. And that is destroying the system of this country.
Well, your concerns that you're raising, Dr. Mzukwa, are fair enough, but under the National Health Insurance, which was unveiled by Minister Zweli Mkhize a couple of years ago, the government will provide a package of comprehensive health services for free at private and public health facilities as part of its bid to more equitable access to quality health care. This does appear to be low-hanging fruit for the government to provide universal health coverage for all its citizens. Now, the South African Medical Association seems to be against that.
No, the South African Medical Association is not against that. But what we have noted is that everything that has been said, even the benefits that you are talking about, have not been identified. They are thrown out there as benefits, but they've never been identified. We don't know what those benefits are. So we're calling for a clearer bill. When it comes to even with the regulations, it must be clear what we are talking about. You can't be throwing out benefits, but you're not defining what those benefits are. So all we are talking about now is please clarify issues now in your regulations. Everything must be clear. When you talk quality, you must define that quality. When you talk about benefits, you must specify those qualities, because we've got the question of medical aids, for example. That must play a role, a complementary role. What complementary role are they going to play if it's not identified, if it's not specified, that is not being covered by the NHI? So those are the issues. There is nowhere where the South African Medical Association stands against this bill. But what we stand for is clarity and also continuous engagement with the stakeholders.
All right, you went to town there, defining the importance of clarity in the whole rollout. So what's your suggested strategy or mechanism of the effective rollout of the NHI?
Well, the strategy is clear for us. First of all, we've got issues that we have raised even to the parliamentary committee. We've raised a catalogue of issues there. That we said these are the issues, and we even made recommendations. For example, if you're giving too much power to the minister, and I always wanted to ask to separate the person from the office. We are not really concerned about the character of the current minister. We're talking about, even whoever comes after the current minister. We're talking about the office itself. If you give too much power to that office, it is open to corruption. And we know what is happening already in the country, that there seems to be no differentiation between the political party and government. So we need to separate those two, the office of the minister and also the NH fund, appointment of the board, appointment of the committees. I mean, even going to an extent of appointing board committees. I think it's too much powers given to the minister. So those are the issues that we've highlighted. That we've been specific when highlighting the issues that we're talking about. Talking about contracting as well, the contracts and the accreditations and stuff like that. I think we need to be clear what we are talking about. For example, if you're talking about the private hospitals and the contracting of specialists, we don't know who is employing who. Whether specialists must be employed by hospitals, something that they don't want. No specialists want to be employed by the private hospitals. So I do think that those things need to be clarified before we say we agree. We just can't just agree to the policy. We also know that we are not a political party. We are not policymakers, but we have a huge interest in the implementation of NHI as a stakeholder.
Now, for this NHI to be fully effective and fully rolled out in South Africa, we do understand that the health facilities across the country will have to adopt electronic patient records. Do you get a sense that the government is fully prepared and ready to embrace this?
I think we've got a long way to go. I mean, look at the vaccination at the moment. The vaccination program, we're still struggling to register patients on the EVDS. Sometimes you go to sites where they're still using manual handling of patients' data. I mean, really, at this day and age, we don't expect that even a simple issue of vaccination should a country be struggling like we are doing in our country, in South Africa. So imagine now you come with this huge project where even people who are in far flung areas must be registered in the system. We also raised an issue of asylum seekers in the country. You don't expect doctors to be chasing away asylum seekers. In our training, we have never had, where we are expected to be, challenging the status of a person before we give treatment. That is not part of our training. Our training is to attend to sick patients. So, when we're talking about the state of our IT, I think we still have a long way to go.
All right, Dr. Mzukwa, great chatting to you. Thank you so much for your time.
Thank you, sir.
All right, that was Dr. Mvuyisi Mzukwa, the Vice-Chairperson of the South African Medical Association, speaking to us live via Skype.